All right, so today I'm going to be going over my topic discussion for USP 800 and NIOSH. With this, it's going to talk a lot about the safe handling of chemotherapy agents and hazardous drugs in general. And kind of giving a layout of how this will go, first I wanted to go over the history just to kind of show what led to the regulations we have today. And then secondly, going into what those regulations are and how they're put in place to keep everyone safe. And then three, what we as an institution are doing to make sure we implement these regulations to keep everyone safe. So what does Mountain View, IFCH, and TCI all do to protect their employees, public, patients from hazardous drugs? And then lastly, 4 areas of improvement, just seeing what can we do better, what are some areas of concern, how can we make it even safer for all of us. First thing I wanted to go into was a story, a little bit of background, just showing why these regulations are important. So before these regulations were in place, Sue Crump was a pharmacist during this time. She compounded chemotherapy medications for 23 years. Like I said before, those regulations were put in place. So they didn't have the appropriate PPE. They didn't have the hoods that we have today. So they compounded a lot of their chemotherapy medications just on the countertops. And if anything spilled, they just took a paper towel and just cleaned it up and threw it away. Ultimately, all of these exposures led to her getting diagnosed with pancreatic cancer. And unfortunately, she passed away in 2009 at 55 years old. But she advocated a lot for a lot of the regulations we have today, and her stories led to those regulations as well. And then I put this in here just as a little quiz time, just to get you guys kind of thinking about what some of these regulations are before I go into them, but just thinking, do you know what the steps are to handle the chemotherapy spill now? Because obviously it's different. We don't just wipe it up and throw it in the trash. There's a lot more steps that we have now, both if it's in the hood or if it's out on the patient floor or area. And then how can you remember this? This is in the chemotherapy spill and acute exposure policy, and it can be found on the Mountain View policy stat page. If you can't find it, we can help you find it. But it outlines what to do in the event of a spill, how to ensure you and the patient are taken care of and safe, and how to report it so we can learn from it and prevent it in the future. Now, thinking about the safety for patients and us, what type of medications were there before the FDA put in regulations, what could be in medications? So medications were not checked for safety and efficacy in the beginning. This led to medications containing substances such as cocaine, heroin, radioactive substances, and chloroform. There are also lots of other different substances that we now know that aren't safe and aren't allowed to be in medications. These are just a few of them. And this ultimately led to death, injuries, addictions, and lack of efficacy. And one that sticks with me that Jessica had me look at, and if you want to look into it too, you can, was the Radithor death of Evan Byers. It's really interesting. So Radithor was radioactive water, put a picture of it there. So he was taking it for pain. It was supposed to be an acute thing for some pain that he had, but ultimately it made him feel really good. So he kept taking it. And ultimately it led to his bones kind of disintegrating in him and his jaw falling off because of the radioactive substances that were in there that were affecting his bones. And ultimately he passed away due to all of this. Just looking at our regulations timeline, just to see when everything was implemented and how everything progressed. The first thing we had was in 1906, the Pure Food and Drug Act. It prohibited adulterated and misbranded food and drugs, and it was the big stepping stone building block for the FDA in 1930. The FDA protects the public health by assuring safety, efficacy, and security of human and veterinary drugs, biological products, medical devices, food, cosmetics, and protecting us from products that emit radiation. So the FDA does a lot more than just drugs. And then in 1970, NIOSH came in. They also do more than just medications. They conduct research of worker safety and health in all different settings, and they empower both employers and employees to create safe and healthy workplaces for everybody. And then in 2004, NIOSH made their first hazardous drug list. So it lists all anti-neoplastic and other hazardous drugs in the healthcare setting, which we'll go over. And then USP 800 started in 2016, but wasn't enforceable until 2019, and it's still used today. So the USP 800 standards are now required and enforceable. Going into the FDA, the Food and Drug Administration, it started, like I said, with the Pure Food and Drug Act. And then in 1938, we had the Food, Drug, Cosmetic Act. And so it mandates the safety and efficacy of medications, So as you can see down here, it's a pretty lengthy process of getting a drug approved. There's a lot of research and trials that go on to make sure that it's safe and effective for patients. It prevents medications from being adulterated or misbranded or poisonous, or having any sort of radiation in it. Going into NIOSH, that plays a big part in a lot of what we do at the Cancer Institute and when we compound chemotherapy and handle hazardous drugs is the NIOSH list of anti-neoplastic and other hazardous drugs in the healthcare setting. So right now it's the 2016 version. They are working on a new one. There are some drafts, but they're not official. And so, like I said earlier, they conduct research to ensure worker safety and health to empower employers and employees to create safe workplaces. They look at psychological factors, industry-wide exposures, and they develop exposure criteria for toxic material and harmful physical agents. They have the authority to conduct inspections and question employers and employees about processes for safety. And then you can also request an evaluation, and so they can come and do an evaluation if requested. And then they also conduct educational programs for those who are wanting to learn more about how to better implement it into their institution. Some other information that they put out are procedures for developing the NIOSH list of hazardous drugs in the healthcare setting. So it goes over how a drug gets put on the hazardous drug list. And then they also take suggestions on what's put on there and what to take off. So there is a process for drugs getting removed, which I thought was really interesting. And then they also have managing hazardous drug exposures, information for healthcare settings. And so that ultimately just goes over the risk management and potential exposures that you might have and how to handle them. And then going into exactly how the hazardous drug list is laid out. First, we should know that no matter the group category, whether it's 1, 2, or 3, all hazardous drugs should be handled with the same precautions and have the same safety concerns. And then our Mountain View policy stat that we have is personal protective equipment for healthcare workers who work with hazardous drugs. The appendix tables 1 through 4 really detail the appropriate PPE that you need for the different types of exposures. So whether you're giving a tablet, an injection, crushing a tablet, compounding anything, or moving hazardous drugs, it goes over that of, do you need gloves? Do you need a mask? Do you need a gown? It lays all of that out very well, and it's pulled from this NIOSH list. So group 1 is our typical what we think of cancer agents. So our anti-neoplastics, they're possible or known carcinogens. That would be like our cisplatin, crizotinib, or methotrexate. And then our group 2 is our non-anti-neoplastics. So they're not carcinogenic. So this would be our anticonvulsants, immunosuppressants, and estrogen. And then group 3, this is kind of a catch-all. It's mostly just reproductive risk. So this is things like antifungals, warfarin, and vitamin A derivatives, so like our isotretinoin. And so we want to just make sure that we're handling all of these safely, even if, like this one down here, even if, we think, well, I'm not going to get pregnant or I don't want to get pregnant anytime, so I don't really need to worry about being safe. No, we should still be being safe because we should protect ourselves. And then we should also do that so that we're not spreading it in other areas where someone else might get exposure. And then going into the United States Pharmacopoeia, USP 800, this outlines enforceable practice and quality standards for hazardous drugs for patient, worker, and environmental safety. So they have an overarching look at not just the worker and the patient, but also the environment. So it goes over storage, receiving, dispensing, compounding, administering, and disposing of sterile and non-sterile products or preparations. And standards to be follow that should be in an institution's occupational safety plan include a list of hazardous drugs and the following. So all of these different boxes are something that should be in our institutional safety plan, which they are, and can be found in all of our hazardous drug handling procedures on policy stat. So going into that specifically, how are we meeting these regulations? Like I said, the creation of policies, we have a few. The PPE for healthcare workers who work with hazardous drugs is one that we've mentioned before. And then the appendixes. Then we have hazardous compounds, and then hazardous drug spill and acute exposure management. And then for meeting the regulations in this table here, we ensure that we have the appropriate PPE and compounding equipment. So we have chemotherapy rated PPE. We have a negative pressure compounding room for chemotherapy and ventilated chemotherapy compounding rooms. We have the closed system transfer devices for compounding, so we don't have to worry about needles and pressure and medication spitting out at us. And then we also have the PAPR devices for certain chemotherapy agents that might volatilize. and for when we're cleaning the clean room as well with the paradox. And then going along with the cleaning, we do have cleaning requirements. So we have the appropriate deactivation agents for cleaning, so like our paradox. And we also have two-step cleaning kits that are easier and safer than paradox. And then we are cleaning the chemotherapy room and hood despite using it or not. And then we have a list of hazardous drugs and stickers provided on shelves or omnis to notify personnel. The stickers aren't on every single omni shelf, but it's something that we've been thinking about and might implement. But at IFCH, a lot of our down in the pharmacy where we're holding the medications, we have a specific hazardous drug shelf, and they do have hazardous drug stickers on them. So we do have that laid out down there. And then we do chemotherapy training for handling and compounding. And then those who do compound chemotherapy pretty regularly, they do get yearly blood tests to make sure that they're not getting too much exposure. And then lastly, just how can you help? Just asking questions and being receptive to questions regarding precautions with suspected or known hazardous drugs. If you don't know if it's hazardous, you can look it up and then ask the pharmacist to be sure, or anybody else on the team. And then also treating compounded chemotherapy like any other hazardous drug. Ensure that you have the appropriate PPE, cleaning and storing, and when you're transporting it to the patient's room or floor. If you see something, say something. If something doesn't seem right, ask. Even if you're not sure, just see, kind of what the process is and asking there. And then all hazardous drugs, like I said earlier, no matter where it is on the NIOSH list, should be handled with the same precautions and concerns of safety. So something that we're going to be trying to implement at IFCH Mountain View is some of those groups, so like fluconazole and warfarin, we have been using the unit dosing machine. So we're going to look into seeing if we need to unit dose them in the cups like we do with the actual chemotherapy agents, like the group 1 agent. So we're going to look into that and see if we need to do that. And then if so, having 2 different colors of unit dosing. So one color for normal non-hazardous drugs, and then another color of unit dosing for the hazardous drugs. So we're able to distinguish them very easily. And then knowing where you can access your chemotherapy handling policies, and then trying not to be overly afraid of hazardous drugs. You want to ensure you're trained and know the handling of hazardous drugs. Because of this, with appropriate handling and training, hazardous drugs should not be scary. A lack of training or excess fear can lead to more mistakes or exposure. And then just ensuring with that you are up to date on your trainings. So making sure you're up to date on how to handle a spill, and then also how to compound the chemotherapy. And then also just making suggestions on how we can implement more training or processes to make things safer and easier for you. And then with that, I just wanted to end with any questions that you might have or how we can help support you. And so I know this is a video. So after this, if you watch this, if you have any questions or think of anything that you wish you could see on our policies or see implemented in any of our institutions, please let me know. And I can look into that, and hopefully we can start working to implement all of your amazing ideas. Thank you.